And with that, Integrative Medicine and Cancer Care with Denise Spector, PhD, MPH, ANP, Denise Spector is an oncology nurse practitioner and also clinically trained as an integrative health and medicine practitioner through the Academy of Integrative Health and Medicine. Dr. Spector has been an oncology nurse for over 35 years and has been involved in research focused on lifestyle, behavior modification for health promotion, risk reduction, particularly among breast cancer survivors. Dr. Spector, welcome. We're so glad to have you here today.
Hey, hi everyone, and thank you, Tim, for having me today. It's my pleasure to be here with everyone and discuss a topic that I'm very passionate about, integrative medicine.
We are thrilled to have you. Let me ask you, what's something that wasn't on your professional bio that we should know about you?
On my professional bio, well, I am, in addition to an oncology nurse, I'm a yoga instructor as well for inpatient psychiatry at UNC, so a little bit different. And I'm also a educator at down the street, the other shade of blue.
Good for you.
Teaching
Good for you.
Nursing students about evidence-based practice.
That is great. Well, thank you so much. Poll everywhere. Our first question, this is just a mock-up of it. Integrative medicine combines conventional medicine with complementary and alternative medicine. And you can vote true or false in the audience on that. We'll pop that up in a minute. And while we're waiting, we'll do our disclosures. This activity has been planned and implemented under the sole supervision of the course directors in association with the UNC Office of Continuing Professional Development. William A. Wood, MPH, MD, and CPD staff have no relevant financial relationships with commercial interests as defined by the ACCME. Denise Spector, PhD, MPH, ANP, RYT has no financial relationships with commercial interests as defined by the ACCME. All right, now that poll has gone live, so hopefully you can go ahead and answer this. This is always kind of a softball, so we'll take about another 10 seconds. If you're new to our lectures, this gives you an opportunity just to see how Poll Everywhere works, and then we'll have some more involved questions a little later in the lecture. Well, Dr. Spector, I think we're running pretty heavily with true or A. How are they doing?
Great. Got that softball question out of the way.
Good.
Terrific.
Good deal. Okay. Well, integrative medicine and cancer care, and I'll turn it over to you, Dr. Spector.
Okay. First of all, I do want to just say, for the nurses that are out there in the audience today, happy Nurses Week. Today's actually the last day of Nurse Appreciation Week, and just thank you for all that you do for your patients and their families. And just to say a little bit about how I got into integrative oncology, as Tim had mentioned, I've been an oncology nurse for over 35 years, and it's not just a personal passion not just a professional passion, but it's also become a very personal passion and purpose of mine to bring forth more information about integrative medicine for our patients in oncology. I have been a care provider, family members with cancer, and for over 25 years cared for a loved one with a life-threatening illness. And unfortunately saw, while there's great conventional care, I saw firsthand on both sides of the healthcare system where there's a deficit and lack of focus on whole health care in many arenas. So that's part of what led me more towards the integrative side of cancer care. So just to give you a little backdrop on that. And please go ahead and go to the next slide, Tim. Thanks. So the learning objectives for this presentation today will be differentiate between integrative medicine and alternative medicine for cancer patients, describe 3 evidence-based strategies that may help improve the quality of life for individuals affected by cancer, 3, identify appropriate cancer patients or survivors who may benefit from an integrative and lifestyle medicine consultation. And then lastly, state the process for making a referral for patients through the Comprehensive Cancer Support Program. Currently, we're offering these services via telemedicine, so they really could be open to anyone within the network who's willing to have a telehealth visit. So next slide, please. So I think we already addressed this, but what's the difference between integrative medicine for oncology patients and alternative medicine? I can tell you, and you have probably, many of you heard as care providers, there are many patients who come to us saying, what do you think about this supplement? You know, I heard this is a cure-all. Well, we know that there are no miracle cures, so to say. There's no fast fix for any of the situations that our patients are going through. So next slide, please. So there have been some definitions around CAM and integrative medicine. And the one I'll start with is from the National Center for Complementary and Alternative Medicine. Complementary practices, they typically refer to the use of non-mainstream approaches along with conventional medical approaches versus alternative practices, which usually refers to non-mainstream medical approaches instead of conventional medicine. CAM was a term that was used for years and still is used, but it has really started to migrate more towards this term integrative medicine, which is a bit more encompassing. As you can see from the definition from the Arizona Center for Integrative Medicine, that integrative medicine is a healing-oriented practice that takes into account the whole person, the physical, the social, the spiritual, and sometimes we even factor in environmental issues. And it includes lifestyle behavior, nutrition, physical activity, stress management. It also emphasizes the therapeutic relationship between the practitioner and the patient and is informed, I want to emphasize, is informed by evidence and makes use of all appropriate therapies. Next, please. So there is actually, for those of you who may not know, there is a society, is actually international Society of Integrative Oncology. And in 2017, they came forth with their own definition for what integrative oncology is. Patient-centered, evidence-informed, again, field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and aims to empower individuals to prevent cancer as well as become very active participants before, during, and beyond cancer treatment. So next slide, please. So what do we know about some of the uses of CAM amongst our cancer survivors? And when I say cancer survivors, many of you know that's a term used now to be not just patients in active treatment, it's patients anywhere in the trajectory of the cancer care continuum. And studies have varied widely in reports of we're using the term CAM, but could be integrative, and the reports are all over the place. But one report showed that up to 91% of individuals used at least one modality during their actual cancer treatments. I would tend to say that it's probably a little more than that. Another study reported up to 75% of those who were post-treatment used some type of modality. That too probably is more. And most of the studies have been among individuals with breast and/or prostate cancer, just for the fact that those two have the highest incidence of those types of cancers are in highest incidence. However, there have been some studies in colorectal cancer survivors too looking at CAM use. And a large part of, probably 50% of colon cancer patients have utilized some type of nutrition or dietary supplement, as well as MindBody practices, a little less than the nutrition and supplements. And what we do know from the literature is that approximately 30% of patients don't even share their use of these CAM interventions with their providers. So that can be a problem, especially when it comes to the use of supplements which could interact with conventional cancer treatments. And just want to mention there was another study, a fairly recent study in 2019. It was looking at recordings of patients and providers for cancer visits, and only 12% of these patient-provider video encounters that were taped, only 12% mentioned anything about any type of integrative therapy. And I just see that as a bit of a problem when we have many of our patients using these modalities. So some of the characteristics from the studies that we have are that most of the individuals reporting use are female, younger versus older adults, and tend to have higher income or higher education. So part of this could be that some of these modalities are come at a cost. Unfortunately, some are free, many are free at many cancer centers, but things such as acupuncture could be cost prohibitive for some individuals. But there's the flip side of that too, because part of it is that many of our minority patients may not be part of these studies. And it could be very regional, because one study actually showed that for individuals in Hawaii, there was a large percentage of cancer patients who were utilizing traditional healing modalities. So again, the information that we have from our studies might be skewed a little bit. So next slide, please. Common reasons for use of, I'm just going to say integrative medicine, to improve general well-being, to treat side effects of the cancer or cancer treatments, to possibly prevent recurrence or spread of cancer, increase the body's ability to fight cancer, and to prevent other non-cancer diseases such as diabetes, heart disease, things like that. So next slide, please.
All right, and this is where we come up to our next poll everywhere question. What are 2 evidence-based IM interventions for helping decrease cancer-related fatigue? A, aerobic exercise, B, acupuncture, C, taking a 2-hour nap, D, both B and C, or E, both A and B. And if you'll take about 10 more seconds. Thank you all so much for jumping right in there and responding to these questions. This is great. All right, Dr. Spector, it looks like a majority of folks are landing on aerobic exercise and acupuncture. What answer were you looking for?
Taking a 2-hour nap.
Oh,
no,
okay.
Kidding. No, this is great. Yeah,
you had me worried.
both A and B, most definitely. But it can seem so counterintuitive when we talk with our patients about aerobic exercise for fatigue. They're like, I'm so tired. How could I think about exercising? But there's so much literature, over 3 decades worth of literature now, showing that aerobic exercise is probably one of the biggest things that we can inform our patients about to help with fatigue. So great job. Thanks. We can go ahead to the next slide. So the different approaches, I've categorized it based on acupuncture, energy modalities, mind-body therapies, movement therapies, nutrition and supplements, and spirituality. And I do have to say, this is such a big topic, all of this, that I could probably take a day or more on each one. So I'm just skimming the surface for some of these. And if anybody has questions about things afterward, please reach out to me. I wish we had more time, but like I said, it being time limited, I can only just get to a small amount of the literature on this. So we can go ahead and move to the next slide. So acupuncture, review the evidence for cancer symptom management. Statistical findings from a study done in 2015 were that acupuncture could reduce cancer-related pain, fatigue, so we got back to that question, as well as nausea and vomiting. And there are also significant improvements were found for improvement for quality of life in general. Another study showed therapeutic effects for cancer-related fatigue, nausea, vomiting, and on leukopenia, or low white blood cell count. So it's doing something to the immune system as well. And there is some evidence showing that acupuncture can help with hot flashes. Many of our women and men on hormonal therapy have significant problems with hot flashes that affect their quality of life. And they even included a study that looked at the use of acupuncture for hiccups. Some patients develop intractable hiccups from their cancer. So this is good information to know. And I already talked about hot flashes. Some other menopausal symptoms too are definitely improved with acupuncture. Next slide. And just wanted to show you this JAMA Oncology article from last year showing that both acupuncture, so use of those needles, very fine needles, as well as acupressure could be helpful for improving cancer pain. And one point I want to make as far as acupressure can also be used for nausea and vomiting control. And I just wanted to show you these, I don't know how many people have seen these before, these little acupressure bands that can be worn around the wrist. There's a certain meridian or energy line in Chinese medicine called P6 right here in the wrist area. And these little acupressure bands can be quite helpful. For some people, it's not, of course, the panacea for nausea and vomiting. People still need to take their anti-nausea medications, but these could be an adjunct to help with highly emetogenic or treatments that have high incidence of nausea and vomiting. And some studies have shown that they can last, the effects in improving nausea and vomiting can last up to 48 hours or so. So these are available in most pharmacies. They're only about $13, $15. And why I have just clear plastic, they do come in different designs and are even made kind of with fun designs for children. So I just wanted to bring that point up too about acupressure. So next slide, please. And just wanted to mention, recognize that this is a series, a lecture series for all of the UNC affiliates. Not necessarily, people wouldn't have access to the acupuncturists at UNC with the Cancer Center and the Medical Center in Chapel Hill, but there are two medical acupuncturists that we've referred to from our integrative medicine program, Dr. Wenyan Chen through the Department of Family Medicine, and I will just call him Dr. Fan, and I think he would be okay with that. That's a big word, his last name to say, but he's with the Department of Physical Medicine and Rehabilitation. I put up costs just so individuals know that, again, I made this point earlier, acupuncture isn't for everyone because it can be costly. Some insurance do cover it, and we're hoping that that improves over time, but it is an issue, unfortunately. I wish there were free acupuncture services for our patients. But at this time, it's one of those things that I would say check with insurance company to see if they would reimburse. And next slide. For those who don't have the access to the acupuncturist here in Chapel Hill, I just wanted to put this out there so you can look up to see who is licensed in the state. This is a great directory that you can just put in the city or area code where you're at, where you're looking for acupuncturist who's licensed here in the state of North Carolina. A good way to just get a little more information about an acupuncturist if you're looking for that in your areas. And there are a lot of acupuncturists in North Carolina, so hopefully most people in this catchment area, the whole state, would be able to find somebody if they were looking for them. I would just say, ask the acupuncturist what kind of background they have in working with individuals with cancer. So we can move to the next slide, please. So on to energy therapies. And I just want to say that this is an area that many cancer centers are starting to look at. There actually is some evidence for some of these modalities to help improve the quality of life of individuals with cancer. And the thought is that it works through the relaxation line in our bodies. When a practitioner is working with an individual, the relaxation response can come on and help allay some of the symptoms. There was a study in 2017 that looked at major NCI, National Cancer Institute, designated cancer centers to see which ones actually had integrative medicine practices available for their patients, and they looked at energy therapies. And out of 40-some of the cancer centers that were surveyed, there were about 40% that actually had some form of energy therapy, whether it was Reiki or therapeutic or healing touch. So that was 2017. I'm sure there are more now. So just a little background, Reiki was originated in Japan in the early 1900s, and its purpose was to increase health by accessing this universal life energy that connects with an individual's own healing ability. Then there's Qigong, which is an ancient form of Chinese medicine, over 2,000 years old. And the Qi, meaning breathing and vital energy, and the Gong, meaning power, involves the transfer of Qi energy from one person to another. And while this can be used as an energy therapy, it's also a very gentle movement therapy that cancer patients have many of them have actually asked me about. And then therapeutic touch. I'm going to lump healing touch under this too, because they're very similar. They were developed by nurses, actually, and therapeutic touch, developed by an American nurse in 1970, utilizes energy transfer to restore balance and healing capacity. So we can move to the next slide, please. So to just share a little bit about the evidence for Reiki therapy, there was this 2014 study that found among 213 cancer patients receiving Reiki that there was a greater than 50% reduction in self-reported distress, anxiety, depression, pain, and fatigue. And then another randomized clinical trial, those are many of us know, the gold standard of clinical studies. There were 110 pre-surgical breast cancer patients, and they were found to have a significant decrease in anxiety and improvements in mood for those that were in the Reiki group compared to the control group. So there's no downside to it, really. And again, more and more cancer centers are bringing this in to have for their patients. So if we could move to the next slide. Another study from 2019, this was in the pediatric cancer patient population. It was a very small study. There were only 9 patients in this study. It was a feasibility study just to see how children would respond to the use of Reiki. And it was specifically for children undergoing hematopoietic stem cell transplantation. And the results from this study actually showed that it was feasible to deliver it to these pediatric cancer patients, and that trained pediatric nurses could bring this into their practice. There was a highly significant reduction in pain from the patients that were, when they looked at pre-assessment and post-assessment after the Reiki therapy. So that's pretty impressive. Again, it was a small study, and I think we're going to start seeing more studies in this area. Part of the problem is that it's not a type of study that's easy to find the funding for, but hopefully we'll be learning more about this as time goes on. Next slide, please. So stress and cancer. We know that both negative and positive thoughts affect our health. Chronic stress has been associated with worse cancer outcomes. And we also know that approximately 10 to 15% of cancer survivors suffer from some type of clinical mood disorder, such as depression and or anxiety during or following their treatment. And addressing stress through mental health counseling, meditation, and our exercise, such as yoga, could be vital to our patients' well-being and longevity. We also know that chronic stress affects the immune function and it can actually lead to increased inflammation. So managing stress in a healthy way can help healing occur. Next slide, please. So moving on to mind-body therapies. This encompasses quite a large number of strategies. We'll just kind of give an overview for today. Guided imagery, which is the use of a mental picture, a thought, a feeling of some desired outcome, or of a place that typically provides a sense of calm and relaxation. Perhaps like the scene behind me. If one is into beach scenes, that certainly is a nice calming visual for many people. Then there's medical hypnosis. It also uses mental imagery and suggestive words that can help create a deep state of relaxation. Meditation, we're hearing a lot about meditation these days, especially over the past year as we've all been under a tremendous amount of added stress from COVID. So meditation has become ever more popular, and this could involve that focused attention on an image, a word, the breath, or some external object to distract the mind. And then relaxation breathing techniques, which can be embedded in some of the above. There are certain techniques such as abdominal breathing, progressive muscle relaxation, and then just using that simple imagery with the breath. And we can move to the next slide, please. So just wanted to bring these two beautiful scenes up, but if doing imagery with patients, we need to find out what works for them. For some, it might be that beautiful beach scene, but for others, it could be that tranquility of the mountains. So if you're doing this with patients as providers, again, it's finding out what works best for your patient. Moving to the next slide, please. So 5 key aspects of care when use of these therapies may be beneficial. First of all, we must remember to just breathe sometimes. But following a cancer diagnosis certainly is a time where this could be highly, highly important. It's a time that often leads, as we know, to very high emotional distress. For coping with and reduction of treatment-related side effects, can aid in the stimulation of immunity and other healing responses, can help reduce cancer-related pain, and may influence the outcome of disease. So next slide, please. Systematic review and meta-analysis that was done by Hall and others in 2018 included 19 studies. And for those who may not be familiar with the meta-analysis, it's a large review study where they combine the different results from the many studies that they're reviewing and do a statistical analysis to come up with more power in the study findings. So this study here, as I said, was 19 studies. It was focused on fear of recurrence and found that many different forms of mind-body interventions significantly reduced distress among a wide range of cancer patient populations. So we can move on from there. And here, a 2016 study showed that guided imagery and progressive muscle relaxation can help with a cluster of symptoms for individuals receiving active chemotherapy. And this was a randomized clinical study. And the different symptoms, as you can see, were pain, fatigue, nausea, vomiting, anxiety, and depression. Significantly, again, reduced that symptom cluster. And next slide, please. So one area of meditation that many of us hear a lot about is mindfulness-based stress reduction, just a different type of meditation. There are many different forms of meditation, this being a very specific one. 2019, this meta-analysis of 14 studies was in breast cancer patients, showed a significant reduction in anxiety, depression, stress, fatigue, and even some improvements in cognitive function. And as many of us know, for patients out there and for providers, many individuals develop after their treatments this what is termed chemo brain, or that fog mentally. So any strategies that could potentially help with that without taking another medication could add so much value and improve quality of life. And another 2017 review of 6 studies of various cancer types, not just breast cancer, showed that this MBSR, as we refer to it, may even have some effect on biomarkers of improved immune function. It showed some immune function recovery, such as decreased markers, as we know, as interleukin-6 and TNF, or tumor necrosis factor. So some interesting physiologic changes that we're seeing with this MBSR. And one other study of breast cancer patients showed an increase in an enzyme called telomerase. It's a marker for cellular aging and psychological stress. This was seen following a 6-week intervention with MBSR. And some of you may know that our DNA, they're telomeres, or what are referred to as telomeres, part of our DNA, and that are at the ends of our DNA. And when there's increased activity in telomerase, that's actually a good thing for us to have. We know that with aging, our telomeres start to shorten. And this study actually showed some, again, this improvement. So it was only after 6 weeks. That's a pretty powerful change. Obviously, we need more studies to help building power behind this. But I would say that, again, this being a non-pharmacologic, no side effect intervention, it's one worthwhile if patients are willing and open to it. We can move to the next slide, please. This was another large systematic review meta-analysis of MBSR, showing that amongst over 3,000 participants, there were significant reductions in anxiety, depression, fatigue, stress, greater levels of quality of life. There was even that post-traumatic growth. Oftentimes we hear about our individual cancer patients experiencing post-traumatic stress. Well, this is the flip side, where many individuals describe that post-traumatic growth. And some of this has come forth through some of these meditation programs. So next slide, please. I want to mention a wonderful program that's being offered through UNC's Comprehensive Cancer Support Program, or CCSP as it's called Mindful Moments. It's all virtual right now, and as a result of COVID, many of our practices and many of the clinics have turned virtual. But this is offered through one of our yoga instructors, and she can do amazing things one-to-one on the phone or via video, depending upon what a person would want. And this too is something, just like the consultations are available virtually. So for anyone across the network who might be interested, again, one-to-one. And we know that they could improve patients' sense of well-being, quality of life, decrease those symptoms that many of our patients experience, could improve sleep, and can provide that mental vacation. So I put the information at the bottom of the contact. It's Carly Bailey is the contact individual, and Doreen Sarusi Stein is our yoga instructor, meditation teacher for these programs, and it's free of charge. So please think about this wonderful service for your patients. And we can move to the next slide. I also want to mention the UNC, general UNC's integrative medicine, which is separate from the oncology piece. They do a great job with education, and a big part of their service is MBSR training. So I put this up there for anyone who would like to learn a little bit more about it. Most of these trainings are online right now, and the link is up there if you would like to take a look at the course schedule. And this is for anybody, providers, patients, anyone who might be interested. So we can move to the next slide. Moving on to movement therapies, and I am not spending much time on this at all because Carly Bailey and Bree Brennan, two of the exercise physiologists at UNC Lineberger, did an excellent job last month through this lecture series, and their lecture is available if you would like to take a look at it. So this is just kind of a highlight. So in one review of over 66 studies conducted both during and post-treatment, results showed that the majority of exercise studies revealed a significant improvement in cardiorespiratory function, body strength, body weight, functional quality of life, anxiety, mood, self-esteem, and on general symptoms and side effects such as pain and lymphedema. That was the aerobic side. For resistance training, there was a great review of 15 studies that showed large improvements for muscular strength and endurance, physical function, fatigue, and other quality of life measures. Very small improvement in body composition, but the studies were so varied, and some of them were very short, so you wouldn't necessarily expect to see a big change in body composition. But the studies that were longer in duration showed some of the changes in body composition, decreasing body fat, increasing lean muscle mass, which is what we want for our patients. So we can move to the next slide. And this was from a great overview, and I think Carly and Bree may have reviewed this as well. And it's on the slides that you'll have, so you'll have it as a reference when you're talking to your patients. It is really powerful. Physical activity, exercise is medicine, and without the side effects, right? In most instances, you can see for all-cause mortality as well as cancer-specific mortality, there's a substantial relative risk reduction for those who exercise versus those who are sedentary or not moving much. This just looked at breast, colorectal, and prostate cancer, and you can see for cancer-specific mortality, moderate grade evidence, meaning the evidence from the studies was pretty good. 38% for all three of those major cancers of a risk reduction. That's huge, and even more so for all-cause mortality, which might be from diabetes, heart disease, things like that. So again, pretty powerful. So we can move on from here. And just wanted to also include in this yoga. Yoga can be not just a physical form of exercise, but that whole mind-body piece as well. And it is an ancient Eastern spiritual practice that includes what we refer to as asanas, or physical postures, pranayama, or the breathing, regulated breathing exercises, and meditation. with the goal of uniting mind, body, and spirit and bringing about self-awareness and better health. So research on yoga and cancer suggests that yoga has both those psychological and physical benefits. It can improve patients' sense of well-being, decrease depression and anxiety, fatigue, decrease nausea and pain, and it too may enhance immune function. So there's also evidence that yoga affects the immune and inflammatory biomarkers in a positive way. So we can go ahead and move to the next slide, Tim. Thank you. A recent review just this year of 7 studies that focused on yoga in women with breast cancer undergoing chemotherapy found significant improvements in quality of life, sleep, anxiety, depression, and fatigue. Another study, a review of 13 studies addressing yoga and quality of life, found that 11 of the 13 reported some significant changes in either physical or psychological functioning. Some of the limitations, just as with some of the other studies mentioned earlier, are that it's sometimes hard to do these studies. There are small sample sizes in many of them. 6 of the 13, though, for this particular review were randomized clinical trials. So they had the control comparison groups where they found some of those positive effects in our patients. Overall conclusion, the studies really suggest that yoga can be beneficial for fatigue and so many other symptoms. We do need more research with more rigorous studies, but I think there's pretty strong evidence on the benefits. One area, we always need more diverse samples because most of the studies tend to be, again, on women with breast cancer. We'd like to see more diversity. So just want to mention yet another program that's going to be starting, if it hasn't already. I think it was this week that there was a possibility of it starting through the CCSP. There's inpatient yoga, the goal of providing individualized yoga therapy to hospitalized patients. And this too is going to be offered through our yoga teacher, one of our yoga teachers, Doreen. And to find out more information about this too, Carly, the coordinator for integrative medicine, her information is down there if individuals would like to learn more about it. And this is becoming ever more popular in cancer centers as well for the inpatient piece. We do have currently outpatient, and it's all virtual now as well. And Carly can provide information on that too for individuals across the state for their patients who may want to engage in group yoga online. But this one in particular is for inpatients at Lineberger right now. So next slide, please. And just want to bring in, as I mentioned earlier, Qigong. It's not only an energy healing modality, but it's a movement energy modality as well, and has been found to reduce stress, build stamina, increase vitality, and enhance the immune system, as well as, for some, can improve cardiovascular and respiratory function, as well as digestive and lymphatic function. Again, it's been around for many, many, many years. There's more and more programs are offering either Qigong or Tai Chi, which is a form of Qigong. They're both characterized by very slow circular movements and stretches with a focus on balance, as represented with this Tai Chi diagram. It just bringing about the ideas of balance, the yin, the yang, white, black, exhale, inhale. These modalities, Tai Chi and Qigong, help to bring that sense of balance back to the body and mind. And many cancer centers are offering one or the other, or some both, of these types of movement therapies too. And I know there are a lot of programs in the community as well that offer these for individuals who might want to check them out as a nice way to start a movement practice, because it's a very gentle and flowing form of movement therapy. So next slide, please. And I can't go through a talk on integrative medicine without at least mentioning nutrition in cancer. I'm not going to go into any detail about this either because we've had our amazing dietitians speak about nutrition and cancer. Not only is physical activity medicine, but food is medicine and changes things at the deep cellular level. So I'll give you these, you'll have the slide, you'll have some of the resources to look further into this, but we have, from mounting evidence, can recommend to our patients that it's really a predominantly plant-based diet has been shown to be associated with some lowering of rates for certain cancers, such as breast and endometrial cancer. And one study looking at the Mediterranean style diet that's high in fruits and vegetables and whole grains found a 40% reduction in the risk for a certain type of postmenopausal breast cancer among women who adhered to the Mediterranean diet compared to those who ate the typical standard Western diet that we Americans have. So there's so much that can be done with food. Food is, again, medicine. It's powerful, full of antioxidants and cancer-fighting properties. So I'm not going to say much more about that because we still have a fair amount to go over. But again, you'll have these references in the resource list at the end. So we can go ahead and move to the next slide. This is just a cancer Mediterranean diet review. I'm not going to go into that either. Just knowing that there are protective effects that have been seen, reducing oxidative and inflammatory processes at the cellular level. So again, in my visits with patients, I can't not mention nutrition because it's that important and that powerful. So moving on to supplements, I have to say that most national cancer organizations do not support the use of dietary supplements. However, there are exceptions. There are always going to be exceptions. There are going to be cases where individuals come in with deficiencies, such as low vitamin D. And this is an important one because there is an association between low vitamin D and a number of different cancers. We've seen that a lot of women, breast cancer patients, come in with low vitamin D, don't know exactly what's going on, but it's not just breast cancer, it's many other cancers as well. So we obviously would want to support and supplement in that case. And even when it comes to multivitamins, a good quality multivitamin for someone who is unable to get a well-balanced diet, which is most of us these days. We also have to remember that our food sources have changed significantly through the years. The soil has changed. There aren't as high amounts of the minerals that we need in our bodies and in our soil where we're growing crops. So sometimes a high quality multivitamin can be helpful. And I just want to mention this fabulous website called consumerlab.com. It's a third-party testing lab. So if one is taking supplements, if they're looking for a good quality vitamin D or multivite, they can use this website to see which brands, because there are thousands and thousands of supplements out there. While not all of them can be reviewed by this third-party testing lab, many are, so it can give some guidance around higher quality supplements where what is on the label is actually in the product, and that they also look at contaminants. So many of our supplements are contaminated, and I don't think many people really think about that. So important to do so if you're putting this into your bodies. The other big thing, because many people, when they come for these consults, we skipped ahead. They don't recognize that there are a lot of herb and drug interactions. For individuals who are on cancer treatments, we really should know what they're taking, what type of supplements, botanicals, herbs, to make sure there aren't interactions. Our main concern is safety. So oftentimes I will do that review for patients, and some of our pharmacists are able to do that review as well. So just being mindful of that, especially even with like things like tamoxifen, there are a number of potential interactions. So again, there are some cases where we might recommend certain supplements if individuals are having a really tough time sleeping. Melatonin could be incredibly useful. And as we know, as we age, our melatonin, a natural hormone in our body, it begins to drop. So depending upon your patient, maybe melatonin would be advisable. Another one is American ginseng that has been found to be helpful for fatigue. And there is evidence on this. And there's actually enough evidence that some organizations, the Society for Integrative Oncology, has actually recommended this for fatigue. But again, would be very mindful of looking at all of the different medications that a person is currently on to make sure there's no potential interaction. Okay, and we can move on from here. And it's hard for me not to mention spirituality also, because that is a huge part of many of our cancer patients' lives and can be the fuel to help them in getting through the challenge of cancer. Everyone has their own ideas about what works for them. Prayer for many of our patients, meditation can be a form of spirituality. Journaling can be incredibly useful and therapeutic. And I also put up there labyrinth walking. That too it's an ancient form of mindful movement meditation. And there's a picture of a labyrinth up there on the screen, as well as a depiction of a labyrinth that a cancer patient actually painted through art therapy, with the butterflies on it and with the different words that brought forth meaning and purpose and spirituality for them. And we're lucky to have a labyrinth right at Lineberger in front of the Cancer Center. I realize that many individuals may not have one near them. However, you never know. I actually recently found out that there were probably 4 in a 10, 15-mile radius of Chapel Hill. So you could always, if you're interested in looking into this, it's just a beautiful mindful practice. But you could Google and just find out where a labyrinth might be located. Some places of worship have small labyrinths, so there could be something near your location. And then, of course, interacting with nature. There's something called in Japan, in the Japanese culture, they call it forest bathing. And I think most of us have had that sense is when we're out in nature, we get a sense of increased well-being. And it's more than just being out there and taking in the beauty of nature. There's something physiologic that happens. We actually know from some studies that some of our large trees, they emit these amazing aromatic oils that have anti-cancer properties. Again, there's this science to back this. So interacting with nature can be so healing and be a part of a spiritual practice. And then music and art as well. So I think we can move on from this slide.
All right. And Dr. Spector, I hate to interrupt. I just want to let our audience know, because I know we are coming up on 1 o'clock and that some of you have to leave right at 1. So I want to remind them that if you have to leave, that's okay. If you were worried about that credit time, as long as you joined at the beginning, you'll be able to get that. And we will make this recording available. So I know you've got more material to cover, Dr. Spector, but I want to let our audience know if you have to leave now, that's okay. And then you can come back and watch the recording so that you are able to hear about the additional information that Dr. Spector will be presenting. So just wanted to mention that, and then also talking about the dietitian, that we do have lectures from Dr. Spring as well as Carly Bailey and Bree in our series, so you can go back and watch this as well.
Thank you, Tim. And I guess you can tell I'm so enthusiastic about this. There's so much to say. Like I said, I could take a whole day for each topic. Thank you for those who came, and I'm sorry that I wasn't able to finish in a timely fashion. It's hard. There's a lot of information. But I'll try to wrap up here. I just want you to know that there's one large review of 29 studies that revealed that individuals with cancer who scored higher on measures of spiritual and religious involvement compared to those with lower score had higher odds of surviving their cancer. So there's definitely more to that spirituality piece than we recognize. And we can move to the next slide, Tim. Thanks.
All right, and this is where we have our next question. What are 3 evidence-based complementary strategies that could be considered for reducing mood disturbances such as depression and or anxiety in cancer patients survivors? So A is meditation, physical exercise, and Ativan. B is meditation, deep breathing, and Prozac. C is meditation, progressive muscle relaxation, and yoga. Or D, meditation, deep breathing, exercise, and dessert. All right, and do take about just 5 seconds here, since it looks like just about everyone has landed on C. How did they do, Dr. Spector?
I don't know why. Who wouldn't say chocolate? I could debate that one. But yes, as far as the evidence, yes, thank you, everybody. Yes, 100%. Great. Thanks so much. And then importantly, I just want to mention the integrative and lifestyle medicine consultations that I mentioned earlier are virtual, so they're pretty much available for anyone within the network. And the consults that we offer help individuals understand how complementary therapies, such as all the things I discussed today, might decrease the side effects of conventional treatments, as well as enhance the quality of life and their overall well-being during and well beyond cancer treatments. So next slide, please. It takes an individualized approach, considering physical, emotional, mental, social, spiritual, and environmental influence that affect a person's health. Education is offered on strategies that may reduce risk for recurrence, the development of new cancers, or other chronic illnesses. And I just want you to know that lavender essential oil, I just want to put a plug in for essential oils with a diffuser. I mean, the power of a little bit of lavender can be amazing to help in reducing some stress that individuals have. So I often talk about that with my patients, in addition to all the other things. So next slide, please. They're available for anyone, the consultations, prior to treatments, during active treatments, or following treatments. They're typically an hour. I wish they were longer, but for now, that's what I have, an hour, covered by most insurers as a medical visit. And I put the contact for getting an appointment for a virtual visit through our wonderful Robin Herring with the CCSP, with the phone number for scheduling. So we can move to the next slide.
All right, and here we have our next Poll Everywhere question. Who would be eligible for an integrative medicine consultation? A, an individual with a new cancer diagnosis. B, an individual in the middle of cancer treatments with a curative intent. C, an individual who has complete metastatic cancer, or E, all of the above. And how are they doing, Dr. Spector?
I think you all have it, 100%. All of the above. Anyone's eligible.
Excellent.
So the health of my body, mind, and spirit are related, and whomever cares for my health should take that into account. I think that's what many of our patients are looking for. And we can go to the next slide. One of my favorite quotes from William Osler, who was seen as the father of modern medicine: "It is much more important to know what sort of a patient has a disease than what sort of a disease a patient has." And next slide. I have case studies, but I'm going to ask you, Tim, in lieu of time, because I recognize that I'm out of time. And I really tried hard when I was practicing to get this to an hour, but obviously I didn't do such a good job. But these are all available in the slides. You let me know if we should end here or if I should go through one case study. I'm okay with either.
Would you like to maybe very briefly go through one case study, and then we will have the slides available for those who would like to review the other case study as well?
Okay, great. Thank you for that. So this is KM, a 45-year-old newly diagnosed individual with early stage breast cancer. We could advance the slide. So KM underwent a bilateral mastectomy, radiation, combination chemotherapy. She was in the process of having reconstructive surgery and was taking hormonal therapy as well when the two of us met. Additional medical history includes anxiety, depression, migraine headaches, and she was overweight. KM is married. Unfortunately, her husband had stage 4 cancer at the time she was diagnosed. 2 children, teenagers. There was significant financial and marital distress from everything that was going on in their lives. And the request for the referral was for symptom management and overall health and well-being. She presented with several symptoms such as fatigue, bone and joint pain from the hormonal therapy, hot flashes, insomnia, weight gain from her treatments, depression, cognitive changes, constipation, neuropathy, a whole myriad of symptoms. So we can advance the slide. So in brief, some of the recommendations that KM and I discussed were an anti-inflammatory or Mediterranean-style diet with the addition of 1 to 2 tablespoons of ground flaxseed per day, which is a great source of omega-3 fatty acids, as well as a great source of fiber. Recommended, since she had not had a vitamin D level done, that a vitamin D level be done with her next blood draw. And if she was low, we certainly would supplement. In addition to a healthy diet, encouraged her regular physical activity, and referral was placed to Get Real and Heal, the exercise program that Carly Bailey is a coordinator for at UNC. Recommended also yoga through CCSP for stress management, and the use of that lavender essential oil to help as well for a little relaxation. Acupuncture for neuropathy, as well as for sleep. And we also discussed some use of some kind of traditional medicinal herbal teas and melatonin. And then she was already receiving counseling through CCSP. We also talked about maybe some additional support for an online breast cancer support group, because women with breast cancer who join support groups have been found to have better outcomes, actually. And then some just additional things we talked about for that spiritual health potential of journaling, and talked about the use of a specific type of journaling called gratitude journal, just bringing up at least 3 even minor things during the day that she could be grateful for, that she could write down and come back to as she needed to during times when she was really down. So those kind of in a nutshell. I mean, there was a lot more to it in the meeting, of course, in our visit, but that just gives you a flavor for what some of the consultations might be like. And you can read the next case study on your own when time permits, and a very different case study. And I have some resources here for you, and I had a poem that I wanted to read If that was okay, one last thing.
Absolutely.
Thank you. So in light of it being next month, it's just a couple weeks away, Cancer Survivors Month, my amazing husband wrote this poem entitled A Survivor's Pledge. It was written, oh goodness, almost 25 years ago when he was a director of a bone marrow transplant unit at the University of Miami. It was for a reunion for bone marrow transplant patients. I have since read this poem at many of the wellness workshops that I've done for cancer patients through the years, and it has been really well received, so I just wanted to share it with you here. Who among us has not taken for granted the beauty of life, squandering precious opportunities to express love, gratitude, or encouragement? Maybe we need to experience the loss of innocence, our impending mortality, before we can truly see the light. All too often our minds are cluttered with thoughts provoking negative emotions. Fear grips our bodies, leading to states of overwhelming anxiety and stress. Finally, a growth, a murmur, an arrhythmia, a state of dis-ease. We search for answers and quick cures. All the while, the answer lies within. We hold the key to our own destiny. Oh, if we could only tap into the healing light that flows through our veins. If we could recognize that we are an integral part of the universal power, not its ultimate conqueror. Each of us walks through the valley of the shadow of death every moment of our lives. Most are terrified of the unknown. Few possess the undying faith necessary to liberate themselves from fear and repression. As my heart races and my life dashes precariously before my eyes, I make this promise to God. Every moment of my life is unique and treasured. The past is history, the future uncertain, only the present exists. I strive for inner peace and lovingly accept myself for who I am, so that I may be a beacon of light to others. I reject fear and embrace only joy and love. Striving to be successful is irrelevant, for I am already successful in my eyes and those of God. I relish the moment, for only in the present is there opportunity for personal growth and spiritual awakening. I choose life always. And I thank you, everyone, for allowing me to read that poem by my late husband.
That was beautiful. Thank you so much for sharing that. We certainly appreciate that. And we appreciate all of the information that you shared. Let's see, I do see we have one question that came in. Please give instructions to receive the CE credit for your series, please. So as long as you signed up, registered through Zoom, you will receive an email with a code and instructions. If you don't see that later today, you should check your spam filters, make sure it didn't wind up there. And then if for any reason you haven't received that by tomorrow, go ahead and contact us. We'll be happy to help you work through that and receive that credit. A reminder, you do need to claim that within 7 days, and you did need to attend at least 50 minutes of today's presentations. And I see some more questions coming in. Let's see. Here we go. Question, how do I go about referring patients?
So thank you for that question, and I hope you do refer your patients. There was a slide that had the contact person, Robin Herring, with her phone number. Referrals go through Robin for scheduling appointments for consultative visit. So that was several slides back.
All right, sure. And of course, we do have that slide deck available as well as the recording that will be available. What additional types of diagnostic tests do you get to do to get to the root causes of inflammation or other issues in the body that could contribute to cancer?
Well, I have to say that for our consultative visit, because it is a consultative service, we don't typically do blood work. However, CRP or C-reactive protein is one serum test that can give an indication of inflammation. And if that's elevated, obviously there's something going on in the body that needs to be remedied that can be addressed by some of these strategies that we discussed today. So I hope that answers, but CRP is one inflammatory marker.
All right. And in the interest of time, we're going to take this as our final question of the day. Do you have any thoughts on the emerging field of psychedelics in care of patients who are facing terminal disease?
I do have thoughts on it, but I think I may have to hold on that. There's some really interesting data on that. And, some major centers like Johns Hopkins are doing the studies. So these aren't Johns Hopkins and Columbia University. So these are major academic centers that are looking at this. And there's some, again, really good results for individuals. It's an existential crisis for many people going through a cancer experience. And if some typical mood elevation drugs are not helpful, perhaps for some people this could be helpful. I won't say much more on that, but there's definitely some evidence out there. And if you would like to ask me offline, that would be fine, and I can send you towards some of the information on that. Michael Pollan actually wrote a great book all about psychedelics and use for healthcare. So
right.
he's, yeah.
And of course there's, okay, we understand, and there is an emerging body of new evidence. There was an interesting report that was released just a week or two ago. So, all right. With that, we need to wrap up. Thank you for all of you who have stayed with us, and we want to thank the state of North Carolina, the people of North Carolina, for their generous support of the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center. We want to thank Mary King, Veneranda Obore, John Powell, and Aaron Schmidt, the team here at the UNC Lineberger Cancer Network, for all of the hard work they do to make this and all of our lectures possible. Additionally,